Okay, so we are just at 5 after 5:30, so I think we can go ahead and get started. And I just want to start by welcoming everyone. Thank you all so much for being here this rainy evening. It's raining here in Springfield. But we really just appreciate you all joining us this evening. This is part of our We Are All Public Health event series. If you did not know, April is Public Health Month. And so this month we have a series of trainings going on for community to partake in and just gain some knowledge about these different topics of public health. And so just want to go over a few housekeeping items before I hand it over to our presenters for this evening. So if you have any technical difficulties or you need help with anything as far as the Zoom is concerned, feel free to send a direct chat to one of the hosts. And when you go to the chat function, you should be able to see an option that says hosts and panelists. You can just send your question there. We will get back to you. We are recording this webinar. It's currently recording. The recording will be emailed to registrants and also posted on the Public Health Institute of Western Mass's webpage. When the webinar ends or slightly before it ends, we will ask that you please complete a very short survey about your webinar experience. It shouldn't take any longer than about 3 to 4 minutes. This allows us to continue improving our trainings and doing workshops via webinar. So please take a few moments at the end to complete that evaluation. We'll send out the link after. There will be a brief Q&A after the presentation. You can submit questions. You should see a word bubbles on the bottom of your Zoom screen that says Q&A. You can just click that and enter in your question at any time throughout the presentation. And we will make sure to get to those. And if someone posts a question that you also would like to know the answer to, you do have the option to upvote, and you do that just by clicking the thumbs up, and that lets us know that that particular question is popular, and we'll sort of bump it to the top to make sure that we are able to get to the questions that folks are wanting to hear about the most. And let me just go through my list. Yeah, and that's about it. And so I realized I did not introduce myself. My name is Tiffany Rufino. I am the Youth Mental Health Coalition Manager. Our coalition is convened by the Public Health Institute of Western Mass. And the Youth Mental Health Coalition works on preventative methods to safeguard youth mental health. One of our initiatives is professional development and community education. And so that's why we have scheduled this training and a couple of the others that you may have seen listed on that calendar that we had up on the screen earlier. And we just really want to make this information around mental health accessible to folks and make sure that everyone who is interested has the opportunity to learn more about youth mental health and mental health in general. So if you would like, you may have been asked during your registration process, if you want to hear more about the Youth Mental Health Coalition, please sign up for our newsletter, and I can put that link in the chat, and then you can stay informed and up to date on everything that we have going on. And with that, I will pass it off to Alex. He is our presenter this evening from Behavioral Health Network. And Alex, the floor is yours.
All righty. Thank you so much, Tiffany. Well, the first thing I'm going to do so that I don't forget it, because it is important to you all, is share my screen. And just reconfirm that if folks can see that okay. Perfect. I see the head nod from you, Tiffany. Thank you. As Tiffany mentioned, my name is Alex. I am here from Behavioral Health Network. Just a few items about myself. I am a clinical training specialist for BHN's Center for Education and Professional Excellence. I have almost 15 years experience in training and development for employee assistance programs. I also have a social work background and am a graduate of Westfield State University here in Western Mass. I have coming to you with some information about youth mental health, of course, but I'll also be speaking, particularly if there's questions that arise from my experiences as an outpatient therapist. I primarily worked with adults, but I did work with quite a few kids as well in my time as an outpatient therapist, and also in my experience working for Bay State's partial child hospitalization program. So that's just a few things about me. And then obviously we are here today to talk about youth mental health. I'm going to go over a little bit of a preamble before I jump kind of fully into our content today, but just to identify some of our objectives for this training. Youth mental health. There's so much that could be covered on this subject. There's going to even just be sections of our training today that, like, I remember taking a full 3-credit course, for 15 weeks on. So there's only so much that we can kind of compact into our time together. It's such a broad topic. So to define the scope of this overview, our objectives are to provide an understanding just of what youth mental health is, why it is important as a conversation, why it is important as something we should be paying attention to. Those of us who either have kids or work with kids, or even those of us who work with those that work with or have kids. By the end of our time together, our hope is that you should be able to identify some of the key differences between, for lack of better terms, normal or typical mental health, and when mental health, in terms of patterns of behavior, changes in thinking, etc., becomes a concern and may be indicative of a disorder. We'll also look at some theoretical frameworks pertaining to childhood development, because the interventions we use to address problems can vary greatly depending on the age of the youth. You would not use, for example, the same approach to an issue with a 5-year-old as you would with a 15-year-old. By the end, you should be able to identify some risk factors that can influence mental health challenges, and know the 3 most common mental health disorders that affect youth, and hopefully also have an understanding of some potential treatments and prevention methods. Those were our objectives. This is a little bit of our table of contents. It's sort of the order of operations that we're going to go through. We're going to start with defining what youth mental health is, why it's important. We're going to give you that overview of childhood development, a couple of theories pertaining to it, and then we'll get into risk factors, the common mental health disorders that affect youth, and treatment options and prevention methods. There will be times throughout our time together where I may pause just to check in with the group, see if there are any questions. But for the most part, we will also have time at the end of our content for some more direct Q&A with everybody. So if there are questions that arise, feel free to raise a hand. Feel free to throw it into the Q&A that was mentioned earlier. If I can address it in the moment, I will. If I feel like it's best saved to the end, then I may pivot to that direction, just to kind of give that heads up. Tiffany went over some of our training norms and sort of housekeeping items already. Thank you so much. And let me just get a couple of items. I like having the chat box open on a different screen. And then okay. All right, I can't access that for whatever. Okay, my last preamble before I jump fully in. We're going to keep things very high level. This is just a basic overview, but we are going to touch on some potentially sensitive things. In particular, I will give you a trigger warning. There's 2 statistics that will be provided pertaining to suicide So I just want to let you know that at the onset. If there's anything that I go over that feels heavy, I want you to feel comfortable to take care of yourselves. Everybody is already, I think, off camera, but if you need to step away from for a moment, feel free to do so. And then just, being mindful that we're talking about this really important issue. This is something I like to do before kind of fully jumping in, is just taking a moment to center ourselves. I want to really encourage everybody to be present today. You have allotted this time to be here, so try to mitigate those distractions. Try to put your phone down if it's something you've got, if you're doing something in the background. And I just want to invite everybody into just a mindful moment with me really quickly. You don't have to do anything in particular, but just take a few deep breaths with me. You don't have to count seconds or do anything in particular, just what feels natural to you, but breathe in through your nostrils a bit and out through your mouth. We're just going to do that for a couple of times before I jump in fully. And really just focus on your breath for a moment. If you feel inclined to do so, you can close your eyes. If it's helpful, you can put a hand on your chest so yeah, you can feel your breath. If you've got a mantra that you like to use when doing any sort of mindfulness exercises, you can kind of think of that or say it out loud. All right, nothing too complex, real simple. And thank you if that was helpful for you. That's just a way I like to sometimes start things out. So this is our first section here. What is youth mental health? And I want to take youth even out of the equation for a moment, because mental health is something that we all have, adults and youth alike. And it is not merely the absence of a disease or a disorder. Mental health it encompasses several things. In fact, how we think, feel, behave, our psychological, emotional, and behavioral selves, but it is also our very well-being. Think about how you move through the world around you, how you respond to life's changes, to its challenges. Mental health is our ability to adapt, to meet our own needs, to develop skills, um, to develop healthy coping mechanisms for managing stressors and changes that we incur throughout our lives. It is our ability to connect with others, to develop fulfilling, meaningful relationships, to realize our potential, to set and achieve personal goals. Now, for youth in particular, what I want to note is that young people face so many changes within such a brief span of time, and a time when they have not yet fully developed their own coping tools or skills. Children are born into families and systems that they did not create. And so as kids, we grow up trying to figure out a lot of things all at once: who we are, where we fit in, what are the rules, how am I supposed to act or behave, how do I want to be known? And within those sorts of questions, kids can also are also trying to figure out how much control that they have or don't have amidst constantly changing variables. Everyone faces stress, but growing up as a kid is an extremely stressful thing at times, just due to the sheer amount of things that kids have to learn and adapt to quickly as they age and develop into adults. And so this is really the important distinction to keep in mind when talking about the youth in youth mental health. As an adult, I face a lot of stress, but I am at least much more established in who I am. I know a lot more about myself, where I fit in, what's good for me, what's not good for me in terms of coping tools or boundaries. I know for the most part what I have control over and what I don't have control over. There's always more to learn, of course, but I'm not starting from scratch, whereas children are. They are dealing with stress while trying to figure out how to deal with stress simultaneously. And that in and of itself can compound the stress that they experience and contribute to mental health challenges that they could face. So mental health Again, it's our thoughts, feelings, behaviors, our well-being. And it can get influenced by our environments, changes in our environments, in our lives, in our relationships, our resources, and many other factors. Mentally healthy people can and do face a wide range of circumstances that can cause us to think or feel in ways that may disrupt how we normally think or feel. As an example, a generally happy person can become sad. And sadness is a normal human emotion that we experience when facing something like disappointment or loss. Beyond sadness, we can face a host of other feelings that often get coded as negative, even though they aren't necessarily negative. Things like sadness, grief, anger, frustration. And when we feel certain things, at times this can impact our behaviors. We might get moody. We might get quieter than we usually are. We might need some alone time when we're usually sociable. We might need to take a day off or cancel a plan. We might lash out sometimes at someone unintentionally. We might cry or just notice changes in our bodies like tension, fatigue, sometimes even uncomfortability or pain. Everything that I just mentioned is not inherently bad or negative. As humans, we can only handle so much at once, and even folks that we might consider to have the best of moods can have bad days that disrupt that mood, that can impact how a person presents or behaves. The key difference when thinking about mental health and mental illness comes down to the patterns. Mental health disorders involve long-term patterns of changes in thinking, feeling, or behaviors. Not only that, but those patterns also, generally speaking, will cause disruptions or distress in an individual's daily life. So let's go back to our sadness example and crying as an example. Those things by themselves are not indicative of mental illness. But if there's a pattern of feeling sad and crying quite regularly, almost daily, and that pattern persists for a significant length of time, and the severity is such that one cannot even focus on school or work or their relationships or even taking care of themselves, that is when we might be looking at a mental illness. In this case, possibly depression, depending on the other patterns occurring in conjunction with the sadness, with the crying. So mental health disorders in children are defined by disruptions and delays in developing what we would consider to be age-appropriate thoughts, behaviors, and social and emotional regulation skills. And the delays or disruptions are significant enough to cause challenges in the home, school, community, within their relationships, or a combination of all of the above. The positive note here that I want you to be mindful of is resilience is an important skill that we all possess. It aids us in managing our feelings, our moods, and mental illness at times. And youth in particular are especially resilient. I do have a video to share, but I should have confirmed this before we started. Can folks hear the audio to that? No. Okay. Let me try something really quickly. Okay. I'm going to stop sharing for just a moment. Okay, can everybody see that again? Perfect. And can everybody hear that now? Perfect.
You can't tell how someone feels just by looking at them or what they share online. To the outside world, our lives may look perfect, even if in reality they aren't. I'm always worrying about doing well at school, and with the end of year test coming up, I'm not sure how much longer I can cope. My thoughts swarm around my head, sometimes keeping me up all night. Some days it's just all too much, and I feel like I'm lost in space. When I did badly on one of my tests, I just about kept it together until I got home. Then I broke down crying in front of my mum. She listened for a bit, and then she told me that, just like physical health, we all have mental health. It's our feelings, our thinking, our emotions, and our moods. She then said that feeling down, angry, and stressed is a normal part of life. Just like it's normal to feel happy, confident, and carefree sometimes. We all have positive and negative emotions that come and go based on what's happening around us. These are everyday feelings. Good mental health means experiencing negative emotions. It's not always about being happy. Mum can relate to the feelings of stress. So when Mum suggested I take a break from everything and do something I enjoy, I actually took her advice. So I made myself a hot chocolate, snuggled up in a duvet and watched a film. And you know what? Afterwards I felt so much better. Mum should take her own advice.
Most of us only ever share the good things. We don't like to share how we really feel. Every morning when I wake up, negative thoughts stream through my head. Getting out of bed and pretending I'm okay takes all the energy I have. As the day goes on, the negative thoughts turn from a stream into a river. The water rushes through my head so loudly it's hard to concentrate in lessons. And some days it's so bad it feels like a waterfall that's trying to pull me over the edge. Everything is so overwhelming. I didn't think my friends would understand if I told them how down I was feeling. But when Sasha opened up to me about how stressed she was feeling, I told her. I wasn't sure how to bring up how I'd been feeling, so I started by saying that I didn't feel like myself. Just her listening made me feel like she understood. She told me some things that had helped her, so I tried them too, but it didn't make much of a difference. Even when I tried to be around my friends, I felt alone. The things I used to enjoy weren't fun anymore.
I was really worried about Andre and not sure what to do. He was quiet and wasn't hanging out with us like he used to. So I asked our head of year for some advice. He suggested I get Andre to speak to him since his negative feelings weren't going away.
I didn't want to speak to our head of year, but I also didn't want to keep feeling so down, so I went. He said that sometimes we have overwhelming feelings that can be more intense than our everyday feelings. These feelings hang around for a long time and change the way we feel, think, and behave. They can stop us doing what we want to in life. That's what I was going through. He also said that if we're physically unwell, we let people know, we ask for help. It should be no different with mental health. Sometimes our overwhelming feelings are brought on because of things in our life. Sometimes they happen for no reason at all. After hearing this, I felt much less alone and it felt good to talk. Scientists have found exercise can help when you're feeling low, so our head of year encouraged me to sign up to the school football club, which Sasha was already in. I still have days when the river is there, but now I'm beginning to understand my mental health. I'm learning how to cope. Our head of year reminded me that my friends, family, teachers, and lots of others at school are there to help just as much as he is. I had no idea the people around me could be so understanding. And while it's not always easy to talk about my mental health, the person I'm talking to might be able to help. If you don't feel like talking, that's fine. You could try writing, sports, reading, art, music, playing with your pet, whatever makes you feel better.
If you're the person someone talks to when they're struggling, just listen with no pressure or judgments. You don't have to have the answer. If you feel unsure about anything, you can speak to a trusted adult. Talking about mental health doesn't have to be difficult. After all, it's something we all have.
Oh, no, started playing it again. All right, and then I want to go back to my PowerPoint. Okay, and we're back up. So that was a video to kind of just give you some examples of what youth mental health could look like in practice. Some examples of a rough day that Sasha had, or a rough set of days that Andre was struggling with. I want to just call attention to some of the things that I noticed from that video. Is the self-care that was involved, taking care of ourselves when we are having rough days, whether that's indicative of a mental illness or not. Self-care is really important. Talking to others about our experiences are really helpful. And again, these are things that apply to adults as well as children. Are there other things that people noticed from those two examples, from Sasha's story, from Andre's story? Any questions that folks had on that video just before I continue? And if not, it's okay. I just want to use this as a moment to check in.
And I just want to remind folks, if you would like to unmute, just raise your hand, and because it's a webinar, you're automatically muted. But if you just raise your hand, just use the raise hand function on the bottom of your screen, we can unmute you and you be able to speak. But I just wanted to say, I thought that was a great video, Alex, and just kind of illustrates for those of us who work with young people. I'm not a teacher, but we do work with young people, and it just helps us to realize that there is so much going on in their heads that we don't necessarily know about. And sometimes they can present themselves as, having an attitude or disinterested, but this was just a good reminder to remind us that there could be a lot going on, underneath it all.
Yeah, absolutely. There's definitely a lot that sometimes goes on in young people's minds, and at a time and an age where they sometimes don't have the best ability to articulate exactly how they feel. And then Sarah, thank you. You had put something in the chat. I like how they made it clear that there's no one size fits all answer. Absolutely. There is not a one size fit all answer for youth, depending on what they're going through, what they're experiencing, what they're feeling, also their environment, their social location. There's a lot to be taken into account. Yeah, and what worked for Sasha didn't work for Andre, and that is okay. Sometimes it is a matter of trying different things, playing to an individual's strengths. That's something that we'll talk a little bit about towards the latter portion of our time together. But thank you for those comments, folks. So we're moving into our next section, which is why youth mental health is so important. This is a shorter section. I want to simply say for this question that youth mental health is important because mental health is important. When we ignore our mental health, we can worsen patterns that we might fall into when not at our best. And youth in particular, again, face a lot of changes and challenges in a brief period of time. Adolescence is a unique and formative time for a lot of forms of growth. They are also highly vulnerable, as children can often be exposed to the risk factors that we'll get into later, things like poverty, abuse, violence, etc. So promoting mental well-being, promoting healthy coping skills for stress, and protecting people from adverse experiences and risk factors is important for all. It is especially important for youth because the consequences of not addressing youth mental health can impair a child's development to the extent that it can impair their ability to have healthy and fulfilling lives when they become adults later on. So some statistics just to kind of emphasize the importance of mental health and the prevalence of mental health struggles among our youth today include 1 in 5 teenagers will experience a severe mental disorder during their life, as well as roughly 13% of kids between 5 and 15, more than 1 in 10 between that age range. Something to be mindful of. And half of all mental health conditions begin by age 14. However, most will go undetected and subsequently untreated. Globally, depression is one of the leading causes of mental illness and disability among adolescent youth. That is one of our three diagnoses that we'll talk a bit about later. And suicide is the second leading cause of death in 15 to 19-year-olds. It is the lead cause of death among 14 to 15-year-olds. These rates have fluctuated a bit in the last few years, but they have risen steadily among our youth since 2010. They've risen steadily prior to that, but it's gone up exponentially since 2010. And there's a lot of factors and reasons that we could get into that we won't today, but that is something for you to be mindful of if you have children or if you work with them. Before we move on to our next section, just some information and a quote here. As parents and caregivers, paying attention to the mental health of youth is essential. And it's good to know, and this is a quote from Donald Mordecai, the presence of a caring adult can make a big difference. He's the national leader for mental health and wellness at Kaiser Permanente. Studies show that even one safe, stable, and nurturing relationship can be a major protective factor in the face of traumatic events. So something, again, to be mindful of, and this is a protective factor that we will talk a little bit more about as well later on in our time together. So we're going to get into an overview of childhood development. We're going to go over a couple of developmental theories, understanding what development and varying developmental stages look like can be really helpful when assessing for mental health issues. It also helps with knowing how to best intervene when needed. I mentioned earlier, you wouldn't necessarily use the same approach for a 5-year-old as you would for a 15-year-old. Some things to note is that there isn't a universally defined distinction between the terms child, adolescent, or youth. I've been using them sort of interchangeably. Chronological age is not the only criteria for establishing that definition, but just as a working definition, the Convention on the Rights of the Child defined a child to mean every human below the age of 18 years of age, unless under the law applicable to the child majority is attained earlier, which is just a nice way of saying in our country, the US of A, a person is considered a legal adult at the age of 18. Therefore, anyone below 18 is legally a child, but these laws vary nation to nation. Additionally, the term adolescent, just to note, is considered the age in which a child is a teenager. So that 13 to 19 age range. Now, in speaking of development, there are several domains of development. We're not just talking about one aspect here. We're not just talking about physical growth. But when children grow, it's more than that. It's also cognitive growth. They're growing socially and emotionally. Their language is developing more. Their vocabulary is growing. Their ability to communicate thoughts and emotions and feelings grows. Their logic and their reasoning develops, not just from a cognitive mental stance, but also a moral sense. Their values, their attitudes, possibly even their spiritual beliefs can grow and develop in varying ways. So development is not just one aspect. There are several aspects to our development. So a callback to our last section, which asked why youth mental health is so important. A very concrete answer to that question is our first bullet on this slide. By age 5, 90% of a child's brain development occurs. 90% by the age of 5. I've heard this analogy so many times, and I use it frequently when talking about young children, and it's truly a great example. Children are sponges. They are soaking up everything, particularly in those early years. Children are using their senses nonstop to perceive their surroundings, to learn about their environments, even before they begin a formal classroom education. And children who don't develop sufficient language skills in the first few years are up to 6 times more likely to experience reading problems, and that alone can impact further education and other areas of development. This is why a lot of developmental disorders are diagnosed in the first 5 years. And also early exposure to trauma can have devastating impacts, especially if the trauma is acutely severe or chronically long. If children aren't meeting basic developmental milestones, things like walking, talking, toileting, eating, playing for their age, it is important to involve a pediatrician or child specialist for further assessment and intervention. The next age range that we'll look into is 5 to 12, which can be considered pre-adolescence. Growth is still happening during these ages, but it does slow significantly than within those first 5 years. Despite the slowing of growth, trauma and adverse childhood experiences can still have a multitude of devastating effects on a child and negative impacts later on in life. By this age, not all but many children tend to develop increases in their attention spans and improvements with impulse control. So this is where ADHD begins to get looked at a lot more in children around this age that are still struggling with attention deficits or impulse issues or other related areas. Again, the thing I want to emphasize here, so our last bullet, recognizing mental health distress in pre-adolescence involves noting frequent patterns. Again, I want to call your attention to those 2 words, frequent patterns, because things like tantrums, excessive worries, those are common in children, particularly pre-adolescent children between 5 and 12. They do have tantrums. They show emotions. They cry. They get upset. That is normal. That is part of normal human behavior. It's part of normal human development. But if you are experiencing those at a high frequency, if they've become patterned and in a very problematic way, that is when you want to consider that you might be dealing with possibly a mental illness. But just a tantrum by itself, just a child that comes home from having a bad day at school, I don't want you to feel too alarmed. Those are normal things. Again, you are looking for patterns when trying to distinguish between mental health and mental illness. Now, not all of a child's development is easily observable, but during adolescence, our teen years, is when we can really see visually quite a lot of physical growth. But it isn't just the physical growth that's happening. There is still significant maturation occurring during these years in terms of critical thinking and a lot of other cognitive skills, a lot of social and emotional communication skills. Children develop a lot more of their independence at this age. They start to develop more relationships outside of the family system that they were born into. And while this is a greater time for independence, it is still a very vulnerable age. And it requires firm boundaries, lots of open communication, and healthy habits so that they can best transition into the adults that they soon will be. Trauma exposure can still be very impactful and make a significant difference in the lives of teens, especially if it causes negative patterns to form, because those patterns will likely be carried into adulthood. Speaking to the quote earlier, healthy adult relationships outside of the family system can have really positive effects for youth at this age. A teacher, a mentor, coach, someone that they connect well with and possibly look up to. A strong, healthy relationship can be a protective factor for a child that may mitigate risk factors, which we'll soon get into. So we discussed developmental domains briefly and sort of like larger bracketed age ranges, but let's look briefly at a theory of psychosocial development that comes from Erik Erikson. If I've got anybody on the call that's taken Psych 101, you will likely remember that name, even if you don't remember the theory. But Erikson's theory involves a series of stages that build upon each other. And pave the way for the following stages of development, of which there are 8 in total. According to his theory, if a stage of development is navigated well, the individual develops strengths that will serve them for the next stage and for the course of their life. However, if a stage is managed poorly, the person may emerge with a sense of inadequacy in that aspect of their development, which could lead to a form of arrested development or simply mental health issues. Knowing the stages within this theory can be helpful in determining if interventions are needed to assist, and if so, which interventions might be best to provide a strong sense of self and a greater ability to build resilience when dealing with life stress and mental health challenges. So you can see the list of stages on this slide here. There are 8 stages in Erikson's theory, 5 of which impact youth development directly, while the later 3 occur more in adulthood. So when it comes to youth mental health, we're a lot more focused on the first 5. And again, this theory alone could be covered in a whole course. So I'm gonna talk really fast just to kind of really skim what those first 5 stages kind of look like and what age ranges they affect. If anybody has any subsequent questions, feel free to throw those in the chat. If you just need me to slow down at all, feel free to let me know that as well. But we start with the stage of trust versus mistrust. And this is where we can also consider attachment theory and how well attached a child is to their primary support group around infancy. Does a child develop trust in their caregivers, in their environment? A child that does develop basic trust in its caregiver, a child that doesn't develop trust in its caregivers, in its environments, will struggle likely with fear, anxiety, and their attachment not only to their caregivers, but to others. If they navigate that well and they build that trust, then they move on to the next stage, which is autonomy versus shame and doubt. That occurs around the toddler age. They're starting to move more, walk on their own, perhaps explore and directly interact with their environments, which should be encouraged to an extent. This is an age where you want to start letting a kid do some things on their own, but with careful supervision. If you do everything for a child, or if you react heavily to every potentially dangerous thing a toddler might do, say they begin to climb something, if you react heavily to that, if you yell at them or punish them for their curiosity and autonomy, then they may develop shame and doubt about their own capabilities. If they navigate that stage well, then they move on to initiative versus guilt. This is similar to our prior stage, and remember that the stages are intended to build off of one another. So a child that develops autonomy well, they get comfortable with exploring their environment, would then move on to taking more initiative in other ways, in their play, in their ability to socialize with their family members or other kids their age. And this occurs mostly in preschool aged children around 3 to 5 years. Children are learning to do more things for themselves at this age and stage, and that starts with taking initiative without being too fearful of failure or of doing something wrong. If a child grows to assume they cannot do things or do them or can't do them correctly, not only will they not take more initiative, they may develop guilt about their abilities or perceived lack thereof. And so that leads to industry versus inferiority. The age range for this stage overlaps with pre-adolescence, that 5 to 12 age range roughly. This is where a child starts to develop not only the autonomy and the initiative, but a sense of competency regarding the initiatives they may take. They're building skills, gaining more knowledge. And if a child is feeling a sense of success at this, they'll not only feel more competent, but confident as well. If not, then they may feel inferior, less than in some or many ways, like they haven't mastered anything. And it's also important to note this is an age where kids are especially prone to all or nothing thinking. So even if a child who's mastered quite a bit, if there's an area they're struggling to master, they might still struggle with inferiority because of the one thing that they're not mastering, even if there's several others that they have mastered. Lastly, among these pivotal stages for youth is the identity versus role confusion stage, and this occurs largely during adolescence, those teen years primarily. It may even start in the preteen years. It could even last until early 20s for some folks. I like to conceptualize this stage in the internal family systems language of parts. We all have parts to us in how we can identify ourselves and often compartmentalize ourselves. And children often learn about their roles in life before they distinguish themselves as unique individuals. And the revelation that occurs with somebody learning, wait, I'm more than just my parents' child, or I'm more than just a student in school. That can be a really freeing and liberating revelation for some kids. That could be a very daunting or challenging experience and revelation for some kids. It kind of depends on how they view themselves within their role. If somebody considers them a really good student, the idea of ending school and going into a career might feel daunting because that's a reframe of their role. Versus somebody who really struggled as a student, again, that may be a really liberating experience to be like, well, I'm more than a student. So true to identity itself, this is a highly unique stage for youth and how they navigate it. We are at our fourth section, moving right along. I'm being mindful of the time. 6:22. So risk factors. Very simply, when talking about risk here, we're talking about the chances of someone struggling with a mental health disorder. And risk factors are those factors that will increase the likelihood of a youth struggling with mental health. A protective factor is not necessarily the exact opposite of a risk factor, but I do like to think of it and conceptualize it as sort of an opposite to risk factors. Protective factors are those things that lower or mitigate risks. They may protect a child from developing mental health issues, or they may mitigate the severity of the impact of those issues. And so just some examples of protective factors include things like community support and resources, parenting skills, competencies, resources there, economic opportunities, their environment. Some examples of risk factors include things like poverty, homelessness, experiences of or exposure to abuse or domestic violence, family history of mental illness, family history of substance use, or exposure to a family member's use of substances. When we talk about trauma, often what we're talking about within this context is the overarching combination of recurrent experiences or consistent exposure to various risk factors, like the examples just mentioned. And just to note, each risk factor can affect a child's ability to move through their developmental stages of Erikson's theory that we went over, but also of Maslow's theory about hierarchy of needs, which we'll review briefly next. And so this is an illustration of another theory. It's not necessarily a developmental theory, but it does inform how we can sometimes work and approach children and some of the issues that they face. You can see that this is like a pyramid with our basic needs at the bottom, which is the foundation for which we would build upon it our psychological needs and subsequently our self-fulfillment needs. The premise here is we need a solid foundation in life because without it, we can't build further. or what we do build or try to build, if it lacks that solid foundation, it may not stand. And if we were to consider something like poverty as an example, just one risk factor a child could face, poverty compromises our basic needs. Children in poverty may not have access to nutritious food, to clean water, to a stable roof above their head. And that will then compromise their sense of safety and security. A child that lacks their fundamental physiological needs and doesn't feel safe won't be able to adequately build further up the pyramid. They might be stunted a little bit, for lack of a better term, due to this trauma, because poverty is a trauma. So it's important to be mindful of what's missing in terms of a foundation with kids. We cannot expect children to have the skills to emotionally regulate themselves if they don't have their basic safety needs met. I feel I'm noticing, am I delayed at all? It looked like some things were delayed on the connection is getting lost. My audio is breaking up. Okay. Is it a little bit more back in sync now? I feel like I'm back in sync. Yes, yes. Okay, thank you.
Yeah, sounds good.
Perfect, thank you. Is there anything that would be helpful for me to repeat from the prior slide? Where was I cutting out?
We can look
You-
to the chat, but I think we were able to discern what you were saying.
Okay, perfect. Yeah,
Mhm.
real bullet point, you need a solid foundation
Yeah.
in this life, children in particular. So on the next few slides here, I'm not going to go into a lot of detail. I'm not going to read through these one by one for you, but these are just examples on different levels on both potential risk factors and protective factors. Here, this slide is on the individual level, things like insecure attachment around infancy, or maybe going, down to the bottom, going through puberty earlier than the rest of your peers could be something that impacts you as a risk factor. On the other side, things like having good self-esteem, good regulation skills can be a protective factor for the individual. On the next slide, we're looking now more at the family level. Things that affect families, things like, child abuse or parental substance use. Maybe your parents going through a divorce, especially if it's a tumultuous one. Maybe experiencing a loss within your family. Are some examples of risk factors there. And then some protective factors are having good structure within your family, limits, rules, boundaries, knowing what is expected of you, having consistency. Children thrive really well off of having consistency. So those can be protective factors at the family level. And then lastly, things that could be potential risk factors and protective factors at the school or neighborhood or community level. You can see some of those examples on this slide. I won't go through all of them again, but I do want to call attention to, because we don't have a slide for it, but things that even happen above this level, high level macro things, can be risk or protective factors depending on your social location. Things like racism, sexism, homophobia, if a child is queer, even down to sometimes what state you live in, because different states have different resources. They also sometimes have different laws and regulations. And so things like that can be very impactful and could create either a risk factor or a protective factor, depending on your social location and the environment with which you live in. So that's something I also want to make sure I note there as well. And moving along, so we've mentioned a few of them already. Depression, I noted ADHD. I don't think we talked directly about anxiety, but I'm going to give it away. Depression, anxiety, and ADHD are the three most common mental health disorders affecting youth. Keep in mind some of what we've already reviewed. Mental health distress is common, but distress and a diagnosable disorder are not the same thing. Be mindful of patterns or significant changes in behaviors, especially if they amount to a new pattern, and be mindful of risk factors as they can increase the chances of a disorder or increase the severity of that disorder. Early recognition is so helpful. The earlier that you can recognize, the earlier you can intervene, and that will improve the likelihood of that intervention's effectiveness. So let's talk about these in a little bit more detail, starting with depression. Depression, I'm going to assume most people know what depression is, but I want to note that depression can and does affect not only adolescents, our teenagers, but it can even affect younger school-aged children and even preschool-aged children, around 2% of them. And early childhood onset tends to have a more severe presentation than later onset. Regarding teens, some symptoms of depression may look like what we sometimes consider to be typical teenager behavior. We sometimes think of teens as moody or irritable or temperamental, but pay attention to these moods. Even if they feel within character for a child, even if it may not be a pattern yet, it can sometimes be important to just check in if you have concerns. When checking in, try not to be accusatorial, like why are you acting so depressed? Not a helpful question to ask, especially with that tone. A more helpful approach might be, hey, I've noticed XYZ behaviors, and I just wanted to see how you've been feeling lately. If you want to talk, I'm available to you. Depression can be a very debilitating disorder. It affects not just the mood, but also motivation, energy, sleep, eating habits, our self-esteem. And it can even contribute to suicidal thinking, which sometimes, not always, but sometimes lead to suicide attempts or deaths. So depression is something to take very seriously. Please don't just pass over children you perceive to be moody and ignore them. Check in, express concern, let them know that you're present for them. Expressing care and concern can sometimes be all it takes to intervene, at least as a start. And it looks like I might be lagging again. I'll use this as an opportunity for water. Okay. Let's see if I have any changes to my internet. Connected, secure. Okay, I think I'm back in sync again. Okay. So I briefly touched on these already, but more specifically, within the Diagnostic and Statistical Manual of Mental Disorders, the DSM, the criteria for receiving a major depression diagnosis are to experience at least 5 of the symptoms you see on this slide at a daily or almost daily frequency at a duration of at least 2 weeks. There are different severity rankings, such as mild, moderate, and severe, that get applied based on the number of symptoms, the severity of the symptoms, as well as total frequency, duration, and clinical judgment. Just for more information on depression. And moving on to anxiety. Now, anxiety is not just a singular disorder. Neither is depression, for that matter. There are different types of depression, but the most common one is major depressive disorder. For anxiety, the most common is generalized anxiety disorder, but there's also social anxiety disorder, separation anxiety disorder, panic disorders, among some others. What to know is that 1 in 3, that's quite a lot, of adolescents will experience one of those anxiety disorders, and those numbers are unfortunately also rising. There are some systemic reasons that are contributing to those rates, including productivity pressures, competition. Social media is a huge one. Not to mention the fact that we are still dealing with an ongoing pandemic. The severity of COVID-19 has lessened somewhat, but it is still around. And even if it was completely gone, there's still an aftermath that we are all sort of collectively dealing with. But it disrupted the lives of kids in particular significantly. It kind of altered their lives substantially, especially academically, the ones that I've talked to. These are some of the common symptoms for generalized anxiety disorder. To meet criteria for this diagnosis, a person would have to exhibit at least 3 signs at a frequency of more days than not, so at least 4 days out of the week on average, for at least 6 months. The duration needed to diagnose is a bit longer than for depression. And then again, I mentioned some other types of anxiety disorders, and these have some nuanced signs and symptoms pertaining to them. And so separation anxiety disorder and social anxiety disorder in particular are noted on this slide. Before I move on to ADHD, does anybody have any questions on depression or anxiety? Just to check in once more. If you think of some, we can come back to it. The last common disorder for kids that we'll look a little closer at is ADHD. Now, ADHD is a neurodevelopmental disorder commonly characterized by limited concentration, attention span or lack thereof, impulse behaviors, and or hyperactivity. There are at least a dozen different criteria for ADHD, so I'm not going to go over all of the potential signs and symptoms at this time. I want to just cover the basics for now. ADHD is broken down into 3 types: predominantly inattentive, predominantly hyperactive, or a combined presentation. Something to note about mental health diagnoses in general: there are some diagnoses a child or person in general may receive that applies to how they're doing right now. And that diagnosis may not always apply later on in life. Depression and anxiety, for example, just because you have received this diagnosis does not mean it will be applicable forever. A person who has depression may not always be clinically depressed. Just because they met the criteria before does not mean they will always meet the criteria. ADHD is one of those diagnoses, though, where it is the opposite. Someone with ADHD is most likely to have ADHD throughout their lives. One can learn to cope better with the symptoms, but they won't grow out of experiencing them. There is no known cause for ADHD. However, genetics are a prominent factor. And other mental health issues can co-occur with ADHD, such as the other 2 that we've talked about: anxiety disorders and depressive disorders. Any questions on ADHD that I can try and field quickly? All right, I'm going to move on to our last section, which is treatment options and prevention methods. So promoting awareness is always first and foremost for me. Whether I'm wearing my trainer hat or my therapist hat. Even with my therapist hat, I love psychoed. I love providing helpful resources for people. Knowledge is power, as the saying goes. Knowing what we're dealing with helps to identify problems earlier rather than later. And it can also help with destigmatizing the issues that youth face. I love this line too about focusing on the balance of optimizing positive mental health as well as preventing and treating mental health problems. It truly is about balance. Positive mental health is a great tool in and of itself. How we frame or approach an issue can shape how someone experiences that issue. And things like positivity, radical acceptance, gratitude, those things can go a long way. However, positive psychology and gratitude are not always the most helpful. If someone's basic needs aren't met, you can't radically accept your way out of poverty or other traumatic risk factors. So we need to work on preventing those types of traumas as well. It truly is about balance, and I'm seeing that I'm breaking up again. Yep, my slide won't even move forward now. Went too far. Okay, I think we're back. Okay, gonna take advantage of being back and go quickly, or try to. So promotion versus prevention. Think of promotion as interventions, including information and activities that optimize positive mental health, the things that might be going well, strength-based approaches to enhance what's working versus focusing solely on the issue. And there are some examples that you can read on this slide here. I'll give you just a moment before I move on. So promotion is part of that balance, emphasizing what's working versus focusing on what's not working. Prevention efforts on the opposite side of that balance are aimed more at minimizing or mitigating mental health problems themselves by looking at risk factors, including things like social determinants of health and some of the foundational things on Maslow's hierarchy of needs. So before we move to wrapping up, this is where I want to spend a little bit more time on this slide, how to improve a child's mental health. And it really does start with having a conversation at times. Some really helpful starting points for what you can do as individuals to help kids who are struggling with mental health, or perhaps even just struggling with their mood on a rough day. Some examples on the slide, and I love that this one is at the top. Make sure you're taking care of yourself. I can tell you as a therapist, it was a lot easier to care for others on the days and the weeks when I allotted time to take care of myself also. The analogy often used is if you're on an airplane and those oxygen masks fall for whatever reason, you need to put yours on first before you help somebody else. Self-care is truly, it's so important, not just for yourself, but also it's a good model to youth, to others that are looking to you as examples. Fostering healthy relationships is another good one. This can be as simple as checking in, like I've mentioned, showing some unconditional positive regard and attention and care, allowing space for the youth in particular to share with you, and being a good active listener too while they share. This is also foundational to building trust and rapport. And I mentioned earlier, I think consistency too. It's really important to be consistent. Not only is that really helpful for youth experiencing mental health, because kids often rely on predictable patterns and structure, but consistency also helps, again, with building trust and rapport. Offering some skills and tools around managing stress. Nobody's perfect, but model what you use, what works for you. Make suggestions that are age appropriate for the kid in question, or that plays to what you know their skills or strengths to be. Do your best to promote healthy habits, good diet, enough sleep, movement. Limits around screen time and social media usage are very important in today's day and age. And activities that promote mindfulness and gratitude. Work with kids on building their self-esteem. Model using positive self-talk. Provide some opportunities for independence and acknowledge what's going well for them. And provide realistic praise and encouragement when they do something right. And of course, watch for red flags, those swift shifts in mood, especially ones that become a pattern and persist for longer than a few days, especially a few weeks. And lastly, of course, make sure you check in or refer to another professional if the things that you're doing, if you don't feel like it's enough in terms of its effectiveness, or if you're noticing that symptoms are continuing to persist, and especially if you notice that they worsen. A vast majority of children and youth in need of mental health services don't actually receive them. And there's a variety of reasons why, including limited access, cultural beliefs, stigma about being labeled with a diagnosis, as well as stigma around asking for help sometimes or seeking support. And also, some people are just overwhelmed. Overwhelmed was a word I remember hearing mentioned in our video that Sasha and Andre was something that they felt. And when we're overwhelmed, it's hard to focus and we don't always know what to do. We don't always know where to begin or where to go. Mental health treatments, though, they can vary, and there are different supports for different presentations, diagnosis, and severities of symptoms. Some kids might benefit from therapy, some from peer mentorship, some might need care coordination or case management, some might need medications, and then some might need a combination of some or all of those things that I just listed. And these types of services can be found in outpatient settings. Residential settings are also an option for youth, and when needed, in emergent situations at hospitals. I know I threw a lot at you in this last hour, but going back to our very beginning, mental health is something that we all have, and that includes challenges. If or when problems arise from the changes or challenges that we face, it's important to understand the signs for those problems so that we can seek or offer supports early. Promoting mental well-being, protecting youth from traumatic experiences, and doing our best to mitigate risk factors is critical to addressing the youth mental health issues, which are unfortunately on the rise. Breaking up a bit. You know, it's funny, but I don't like staring at myself, but one of the ways I can tell I'm breaking up is I can see the delay. So if I'm moving back and forth, I promise I'm not just being weird. Okay, there's no lag there. I mean, I am weird, but that's an aside. Bringing it back to our topic and close. By attending today's conversation, I personally hope that you feel that you have a bit of a better understanding about youth mental health at again, a very high level overview, just some developmental theories that influence youth and the risk factors that some kids experience, which may contribute to or exacerbate their mental health. And I hope that you feel more comfortable approaching somebody that you might think is struggling, to offer them support and interventions and resources that could be life-changing for them. And with that, a little bit over time, but we still have, I think, 12 minutes for some Q&A. If there are any questions or even comments, if there's anything that folks wanted to circle back to. And then also at this time, I want to remember to draw attention to the survey that I think was mentioned at our onset. That's something that I don't remember where it is, but Tiffany will provide it. It should be available to you somewhere. Please make sure you fill that out. I honestly would love any feedback, either about the content you heard today, any things that you think could be improved upon, added, things you thought might be missing, or any things pertaining to my delivery. I'd love any commentary or thoughts you have on that, minus the technological lagging. I don't have much control over that other than changing my internet. But with that, I'm looking at the chat. I'm not seeing any questions immediately, but I will turn things back over to Tiffany, and I see that you've added the survey to the chat as well.
Yeah, I did have a couple of questions, but wanted to see if folks in the chat, or I actually don't have access to the Q&A as one of the hosts, so I couldn't put my questions there. But I was just curious, one of your earlier slides had a stat around 20% of youth will experience a severe mental disorder. And I know we talked about anxiety, depression, ADHD, but are those considered severe disorders, or are there others that we should kind of be aware of that are more common or also common, I should say?
Those are the most common. How we
Okay.
consider severity is that's kind of a tough one to concretely answer, but I would say, especially of those three, they are severe, particularly the depression.
Yeah.
That's not to imply that anxiety is not severe, um, but it is among like the clinical reasons why you can get a diagnosis for depression if you've only had symptoms for a few weeks, as opposed to anxiety, you needing to have that set of symptoms regularly for more than 6 months, because anxiety stems from stress, which is, again, is part of life, something that we all experience, whereas the list of symptoms for depression um, can have a much worse impact, particularly when we get to some of the symptoms like thoughts of death and dying, suicidal thinking. Um, it's not explicitly listed as a symptom, I don't think, but self-harm is sometimes, self-injurious behaviors is often common with folks who deal with depression. So in terms of severity there,
Mhm.
absolutely. Are there other diagnoses that are also considerably severe? Yes. Um, I don't know that there's any diagnosis that wouldn't necessarily be considered severe, but certainly the implications of some diagnoses, um, just to put it this way, do have a bit more weight to them.
Mhm. Okay. Thank you. We do have a question. It's asking, can you comment on personality disorders in youth, BPD in particular? And can you
Now,
share what BPD stands for?
BPD stands for borderline personality disorder.
Okay.
Um, I, I, there's off the top of my head, truthfully, I apologize. I couldn't comment on that too much. It's not a specialty of mine. It's not something I've worked with heavily. What I guess I could say, and I think I'm breaking up again.
Yeah.
What I will say, and hopefully you can hear it, um, borderline personality disorder is highly stigmatized. Mental health diagnosis in general are highly stigmatized. There's a lot of great information that continues to be shared about varying disorders and diagnoses, that's helping to dispel some stigma, but BPD in particular still faces a great deal of stigma, and it's often used very reductionist. So it's like we might identify somebody as, oh, this person is selfish, therefore they are narcissistic, they're borderline because they may have one trait or behavior. That isn't the case most often. But offhand, I don't really know what the stats are on how prevalent that is in youth. I'm not even sure if it is a diagnosis that would be given in youth. I don't think it is, but I'm not certain of that offhand.
Thank you, Alex.
Mhm.
And then I'm just checking the chat and Q&As. I don't see any other questions there, but I had one other question around the stages of psychosocial development.
Mhm.
And you mentioned like periods of transition being key times for young people. And I think for those of us who work in youth mental health, we recognize that and can have witnessed that sort of firsthand. And so my question is can you give any suggestions of type of like programs? I know some folks that are on here run program for youth. Are there any like tips or suggestions that you can give around programs that would be good for youth that are in those transitional stages of like 6th grade or 8th grade or 12th grade, like more hands-on activities or, I mean, I don't know. Just thinking about from the standpoint of prevention, what can we do? Or what programs can we set up knowing that young people are going to be having an especially difficult time at those stages?
Yeah. Concretely, I don't know of a lot of like specific programs. What I will say though, get kids involved, eh, o- get them offline as best as you can as parents or supporters of children. We didn't go into a whole lot of depth or detail about it, but that is an epidemic in and of itself. Social media doubled during when the pandemic started among screen usage among that age range. And I think right now it doubled, I think, from 4 to 8 hours a day on average for youth. And that is having detrimental impacts, not only on individual mental health, for individual youth, but collectively, socially, children are losing the ability to connect with others, and that is exacerbating their individual mental health. So if you are a parent on the call, really setting some firm boundaries around screen time and screen usage, and really trying to encourage youth to exercise independence in the forms of participating in anything that feels special and important to them, whether that's joining a sport team at school, if there's a music program that's at the school that they could participate in, if there are some after school programs or activities that they can take part in, or really just encouraging them to cultivate some relationships with their peers offline. Or at least being more aware of when they are on their phones, when they are using a screen, being mindful of how they are using it, because I don't want to demonize technology. It has its benefits. It has good uses. But there's more research. I was literally just in a training earlier today on tech use for youth. And I'm trying to like want to regurgitate 7 hours worth of things that I just learned. That was really impactful. So I don't want to demonize it. What I will say is, be mindful of how they might be using it. If they are using technology to actively connect with their peers, it's not necessarily bad. If they're doing it to mindlessly scroll and they themselves are getting influenced by the algorithms, set limits as best you can.
Yeah, that makes total sense. Thank you for that. Just checking the chat we have. So folks said, thank you for this informative workshop. It's been very informative. We have a child with ADHD/ODD, and some days can be difficult, but we stay positive. I think when you were talking about the screen time, someone said done. They're going to be monitoring more. Yeah, and folks just expressing how much they learned. I think if there are not any other questions or comments or anything, we can go ahead and end our time together today. But I just want to say thank you so much, Alex, for being available and for hosting this workshop. I too learned a lot, and just appreciate everyone who was able to join us today. And I will put a plug for the Youth Mental Health Coalition to first, please complete the evaluation survey. And then also if you work for an organization, or if you have a group that you're a part of that you would like some type of mental health trainings or workshops, we do sponsor trainings for groups in and around the Springfield community. So if you're interested and you have a group of about 8 or so friends or family members or whomever that you would like some trainings for, I encourage you to visit our website, And we can also put that link in the chat or email it out after, and check out some of the trainings that we have available, and reach out and we will schedule some workshops for you. Sarah says she seconds that. Tiffany and her people are amazing. Thank you, Sarah. So appreciate you. And with that, we can close. Everyone can go have some dinner and kick their feet up, hopefully, and call it a night. Thank you again, Alex.
Thank you. Have a great night, everybody.
You too. Bye-bye.